Medicare mysteries and misconceptions revealed in this episode of Retiring Today.
We'll cover paying for, electing, and all of those letters associated with Medicare.
Plus, we unravel the supplement plan mysteries. Join us for Retiring Today.
Welcome to Retiring Today. We're talking about an important decision that pre-retirees and retirees have to make, and it's about Medicare. I'm here with AnnaMarie Morrow. She's the Director of Healthcare here at Merkle Retirement Planning, and this is Lauren Merkle. He's a certified financial planner and a certified financial fiduciary. And Lauren, you've been helping people retire now for over 20 years, and this Medicare piece kind of underlooked, but very important.
It's very much a surprise element of the retirement plan for pre-retirees. I mean, for pre-retirees, you know that Medicare is going to be there at 65. But that's really the main thought, or the amount of thought that most pre-retirees put into it until they turn 64. And then at 64, you know what I'm talking about. You start getting these letters in the mail, these postcards, the phone calls. Even now today, they're getting texts about all of these Medicare options that are available to them. Oftentimes we talk about the complexities of Social Security. Up to 81 different options. You think Social Security is complex, wait till you dive into Medicare and all the options. And even worse, it seems to change on a yearly basis because you have options that you can select from once you originally select Medicare, then every year you can make adjustments as well. So it's complex, but luckily we have an expert on our team, a specialist on our team that's AnnaMarie focuses just on the Medicare part of it to help our family members weave through the maze of the Medicare options.
Yeah, your role is to actually literally dive into this on a daily basis and stay up to date with all the changes. How do you help families with all that knowledge that you've gained about Medicare?
Yeah, it's interesting. Just to touch on what Lauren had mentioned, people come in when it's within that time frame of them turning 65. They have been inundated with so much information, and I don't want to say scare tactics, but it's all this, there will be penalties if you don't elect by this time, and you need to choose this plan. And so there's a lot of stress and anxiety associated with going into that, and they don't know what to expect. And like Lauren said, it's constantly changing. So what I get to do is this opportunity to sit down with families, let them know what's going on. And with every family, it's different. There's a different strategy with everybody. And I get to walk them through that. And it's really rewarding to see how that anxiety can just wash away knowing that they have a plan or someone on their side who's looking at their individual case.
And Lauren, when AnnaMarie is walking people through the options, it's not like a comprehensive plan. It's not just the Medicare lane that you're staying in. When AnnaMarie is helping them make the decisions, she's working with you and the other retirement planners to see how it affects income, taxes, investments, and those other pieces.
Yeah, and that's why Medicare is just one of the guiding principles of the comprehensive retirement plan. The decisions that you make with your Medicare could have a direct impact on some of those other guiding principles, like the tax planning component, or even the investment planning component, the legacy planning, as well as the income planning. So all of these work together, which is why it's important, we feel, to make sure that all the specialists are working together on behalf of our family members to make sure that their plan works the best for them, and there's not all these unintended consequences that otherwise could happen by making decisions over here without realizing the implications of those decisions on these other guiding principles.
And AnnaMarie, the whole focus of today's show is to take all that information that people get and make sure they know kind of how to wade through what's true and what's not. I mean, do you find that there's a lot of misinformation out there, and how does it happen that people just don't get the right facts about Medicare?
Yeah, that's a great question. So many misconceptions, so many myths, but not just that. It really varies when you get down to the supplements advantage plan. It varies county by county. So a lot of what I hear is, well, so-and-so who I'm related to or a friend of mine, they have this plan and these benefits and it works this way. And then the follow-up question is, well, what county are they in? And kind of lights go on, and then it's like, oh, okay. So that kind of eases some anxiety, eases some stress. So there's a lot just in particulars that it just depends on your situation. There's no blanket statement where it's the same for everybody. I think that's the biggest misconception, is everyone's situation is different, because like Lauren touched on, it does inadvertently affect your income planning, your tax planning. They all work cohesively together, and that just makes it different for everyone.
Yeah, and information, part of the issue is information is available everywhere. I mean, you can go online and you can read article after article about Medicare, and a lot of those articles will seem to contradict each other. And so now you are left with the ball in your hand saying, how do I decipher what this means to me? This piece of information means to me. How does this piece of information that seems to contradict this, what does that mean to me? And these are many times permanent decisions. A lot of these retirement planning decisions are permanent decisions. Once you make them, you can't undo them. Now with Medicare, luckily, we do have some options each year to make some adjustments, but how do those adjustments impact you short-term and long-term? And with the mass of information that's out there, it's just hard to weave through it to make sure you get the accurate, meaningful information for you.
Okay, so our goal today is to unravel some of the mysteries and the misconceptions. And AnnaMarie, one of the first ones you want to touch on is original Medicare. So that's Part A and Part B. And the question is, do I have to elect Medicare A and B when I turn 65 to avoid penalties?
Yeah, that's a great question. That's probably the number one question I receive. And the answer is it depends. It depends. If when you turn 65, if you do not have qualified group insurance, let's say you've stopped working, then yes, you would enter your initial enrollment period where you would need to elect original Medicare A and B. But let's say you're not quite retired, you're working full time, you have qualified employee coverage, you may want to look at not electing A and B or just A. It depends on what type of plan you're on, how many employees are in the business you're a part of. So it just varies, and that's one of the benefits of having a planner on your side.
And is the common misconception that you do avoid penalties, don't avoid penalties? What do people typically think?
Typically, people think that there will be a penalty if they don't elect at the age of 65.
Okay, so let's talk about online logging forms and how kind of complicated those can be as we look at one on the screen.
Yeah, there's many ways to elect Medicare A and B. The common form is online at ssa.gov, and it's actually become pretty user-friendly. There's a button you click that's elect Medicare only. You do not need to start your Social Security benefits at that time. Now, if you have already opened an account years ago, make sure that you have your username and password on hand. But otherwise, the form there is pretty simple, or you can make a phone call to your local Social Security office, or there are also forms that you can download online, fill out, and fax in.
Okay, so you can elect Medicare through the Social Security Administration. I was unaware of that. Is that something most people know, though, that are in that age range?
If you go to Medicare.gov and click you'd like to enroll, it will actually redirect you to the SSA.gov website, so either or would work just fine.
But that can offer to part of the confusion, because you're thinking, I don't want to take Social Security, I just want Medicare. You have to go to the Social Security website, and on the home page of the Social Security website, it does predominantly look to provide Social Security information. So immediately some people think they're in the wrong place. And then once you actually do find that channel of how do you get to the Medicare part, that filing itself can be a little bit daunting as well, which is part of the reason with Social Security filing, we filed that for our families as well as the Medicare part of it as well, just to help alleviate some of that confusion and the anxiety that goes with that type of election. Did I actually do it right?
And that's a great point as well. So once you make that election online, if you'd like to check the status, because right now what we're going through is anywhere from 6 to 8 weeks before you receive your cards in the mail, which can also be intimidating as you have to make your supplement options. So there online is a section when you log in that says benefit verification letter, and it will let you know if it's still pending, if it's been even received, and then once you do have your Medicare member ID, it will list it under that section as well.
Okay, let's talk now about the cost of Medicare. A lot of misconceptions. I'll get that word out. Misconceptions, mysteries. You know what we're talking about here. A lot of misconceptions about Part A and Part B and what they cost. And I know around here we just put it in a Google search, and the number that came up made it look like this is what you will pay for Medicare, but that's not what everybody pays.
No, it's not. Yeah, you Google it, and like Lauren said, there's just information out there all over the place. Well, if you've worked the qualified number of years or quarters, so it would be 40 quarters or the equivalent of 10 years, you yourself or your spouse, Medicare A has already been paid for. It's not free, but it's already been paid for through your job history. So then we look at Medicare Part B. That price can fluctuate. So 2020, January 1 of 2020, there was an increase to the Medicare Part B premium to $144. But that can also be affected by your income. So we have to look at what you claimed for income 2 years previously, and that's known as the IRMA, the Income Related Monthly Adjustment Amount. And it varies by what, I believe we're showing a graph here, about what your income ranges are and how you filed 2 years previously. So that could change every year depending on your income.
And I think I've heard you say before that that can be a shock sometimes for people that they look back at the income for 2 years.
100%. Earlier this year, I met with a woman. She was so excited to retire, and she came in expecting, she knew what she was expecting to pay for her Medicare Part B, that $144.60. And then we looked back at her income, and she ended up having to pay over $400 for her Medicare Part B. Now, she could afford it, her income ranges would allow that, but still, that's a sticker shock price that we just don't like to see and don't like to be faced with. So again, that's where that prior preparation and planning really comes into play, is when you know if you're going to elect at 65 or if you're going to work for a few more years, that gives you that space to really dig in and know what to expect when it comes time to know what your payments are.
And there's other types of income besides earned income that goes into that IRMA calculation. And we talk a lot about on the show about Roth conversions and how powerful that can be from a tax planning standpoint. And Molly, this is where the 5 guiding principles are really integrated together, because what you do from a tax planning standpoint, if you're converting large sums of pre-tax money to the Roth side, that's taxable income. And that can impact what you're paying from a Medicare Part B standpoint. So otherwise you might be paying $144 a month, but because you did a large Roth conversions, that might increase the amount of Part B premiums to a substantially higher number. And that should be in that calculation of, does it make sense to engage in the Roth conversions to pay the extra expense that's associated with the increased premium of Medicare Part B? And keep in mind, if you're married, that could impact the amount that you pay as well as your spouse pays, which could double that expense.
Medicare mysteries and misconceptions. I got it right that time. We'll continue with that when Retiring Today continues.
Don't let 2020 derail your retirement. Join us for a complimentary workshop from 6 to 7:30 p.m. During this retirement workshop, you'll discover how to use market volatility to your advantage, tax-saving strategies to grow your retirement savings, and investing mishaps and how to avoid them in a down market. Spots are limited due to social distancing guidelines. Register now for this complimentary retirement workshop by visiting merkleplan.com.
You've heard stories from your family and friends. You may have even received a few calls from sales agents who want you to purchase this plan or that plan. Misinformation about Medicare is everywhere. How do you know what's important and what's just noise? Join us for a complimentary educational Medicare workshop on October 21st at the FFA Enrichment Center in Ankeny. Spots are limited due to social distancing guidelines. Register now at merkleplan.com.
Welcome back to Retiring Today. Mysteries and misconceptions of Medicare. That's the focus of our episode today. The people that are going to help us unravel the mysteries: AnnaMarie Morrow, the Director of Healthcare at Merkle Retirement Planning, and Lauren Merkle. He's a certified financial planner and a certified financial fiduciary. And we're going to dig into HSAs, or health savings accounts, and the misconceptions with those. But first, Lauren, HSAs, a very powerful tool, though, as people head to and through retirement.
In fact, it's so powerful, we had its own show, and we had designated it as a superhero because of the superpowers that it does possess. So the triple tax favor of the HSA is an extremely compelling reason for many pre-retirees and retirees to use that resource. So it's something that we embed within the overall 5 guiding principles of the retirement plan.
Yeah, and to check out that episode that Lauren just mentioned, you can go to YouTube, search Merkle Retirement Planning. We've done a whole series on superheroes and supercharging your retirement, so the power of the HSA is right there on our YouTube channel. So Medicare and the HSA, though, AnnaMarie, some misconceptions there.
Yeah, probably the most common misconceptions that I hear about is I can continue to make contributions up until I elect Medicare, which is true, but again, it depends. So if you are turning 65 and that is when you are electing Medicare, you'll want to stop your contributions up until your election is made. However, if you delay in electing Medicare because you have qualified employee coverage, so let's say you're going to retire at the age of 66, and you're going to elect Medicare, you'll want to keep in mind that you'll need to stop those contributions 6 months prior to when you go to elect. So there's some fine print with that. So let's say that your start date for Medicare A is April 1, and you're 66 years old, and you go to elect Medicare in February. Well, you'll need to go back 6 months. Part A is retroactive 6 months, and they do that from when you apply, not from your start date. So keep that in mind. You want to go 6 months back from your application for Medicare A or B backwards.
And that's some of the fine print that many pre-retirees, many retirees miss. And even if they do read it, how do you apply that to your situation? And then even if you read it and can appropriately apply it to your situation, oftentimes it's forgotten because there's so many other decisions that you have to make with wide-ranging implications. And that's why, again, it's important to involve this Medicare planning into your overall comprehensive plan.
Okay, let's talk now about the supplements, AnnaMarie. So I know we've got A, we've got B. What else? We have C, D.
Yeah, when you're talking about supplementing your A and B, so A and B is just, it's not enough. It covers your hospital and doctors, but there's a lot of gaps within original Medicare, such as just for example, your Part A deductible. That's about $1,400, I believe, for 2020. And then after a certain number of days in the hospital, you're gonna be responsible for 100% of the costs. So that's where supplement coverage comes into play. So there's two basic options: your Medigap, your supplement coverage, which is all those letters you hear about, so F, G, K, N, and then on the other side of that you have your Advantage plans. So we like to sit down, know what the individual is looking for, what they need. We want to look at your medications, your primary care, but also just what would make you more secure, because there's a lot that goes into planning with what would work best for you.
And I get a little confused because all of this is essentially offered by the government and subsidized by the government. Even these, what did you call them, gap plans or supplement plans, those are offered by the government as well, but you pay for those.
So with supplement plans, it's just basically you're filling in the gaps with Medicare. There's no benefits. So you would also need to add in a Part D drug card. D stands for drug. And then you would also need to consider a separate vision, hearing, dental plan. And it's all very basic on what the government requires to be covered. And so then I always hear, well, what's the catch with these Advantage plans? You know, I'm seeing low or zero premium here. There's got to be a catch. You know, they're through private carriers. Well, that's true. They're through private carriers, such as the supplement plan. But what's interesting, what not many people know, is that with Advantage plans, they're actually subsidized by what has been paid into Medicare A and B. That way they can regulate and make sure that these Advantage plans legally are covering what is required or better. That's why we're seeing these Advantage plans with so many great benefits that, you know, a lot of them have the drug card built into it. They have health, dental, hearing reimbursements. Silver Sneakers has paired with quite a few to where you get gym memberships depending on location. These all vary by county, but really the benefits are just looking almost better and better as years go on.
So is that a big part of your role then, to sort of look at the circumstances after you've worked with the retirement planners and you've talked through investments and taxes and all that and say, here is a couple of options that I think will work best for you? Or do you go through every single option with people, or how does the process work?
Well, I just get a feel of what, you know, our families are comfortable with, because it really does come down to a security factor. Because with an Advantage plan, it acts like a PPO, so there's a network involved. So we'll need to make sure that your doctors, your primary care physician, any specialists are in network, and also it's managed care, so you pay as you go. Whereas on the flip side of that, the Medigap plan, you pay your monthly premium, and it's an open network. So really it comes down to a security level, and then, you know, what are you going through personally, health-wise, and what you would be comfortable with.
This is complicated stuff. I mean, you make it your full-time endeavor to learn all of this. Lauren, when people first come into the offices, I'm sure it's got to be kind of overwhelming.
Well, and this is why it's so important to have a specialist for just Medicare alone. And as complex as this really seems throughout this conversation, AnnaMarie does a great job of making this much easier. Because really the process is she sits down with you and she talks about what your situation is like, what the premiums for this option would be, the benefits that you're going to receive for that option, and then you can compare it versus the other options that are available. And she really does a great job of breaking it down and make it very simple to consume. And then, like most of the planning decisions that you are going to have to make, your decision then becomes much more clear when you have that accurate information at your disposal to see how it's going to impact you now, but also down the road.
Okay, one more misconception that we want to go through is once you've elected, so let's say I selected Medicare Advantage, can I then switch to Medigap? What do people think and what can they actually do?
That's such a great question. So glad you brought it up. So a lot of times that is the question I get. Well, can I just try this Advantage plan, see if it's a good fit? And if 2-3 years down the road, I want to switch back to a Medigap plan, would that be an option? It's an option during an open enrollment period, but the catch is, after your first 12 months on an Advantage plan, if you do want to switch to Medigap, you have to be able to answer health-related questions, which is really why I mentioned the secure factor in choosing your plan ahead of time. Because if you feel like there may be a catastrophic event on the horizon and you're just not feeling good about things, it may be too late to switch plans if you have to answer those health-related questions and be underwritten. So they give you this trial period with Advantage plans. And kind of like the route I choose is, let's reevaluate things after maybe 6 months on the Advantage plan. See how you're feeling, see if you're comfortable. As long as you're not having any sleepless nights, let's look at if you're happy, or maybe we need to evaluate making the change then.
It's time for our Ask the Advisor segment. This question comes to us from Dan. Dan in West Des Moines says, I'm self-employed. Can I still open a health savings account? We'll answer Dan's question and much more when Retiring Today continues.
You've heard stories from your family and friends. You may have even received a few calls from sales agents who want you to purchase this plan or that plan. Misinformation about Medicare is everywhere. How do you know what's important and what's just noise? Join us for a complimentary educational Medicare workshop on October 21st at the FFA Enrichment Center in Ankeny. Spots are limited due to social distancing guidelines. Register now at merkleplan.com.
Don't let the coronavirus get in your way of a successful retirement. At Merkle Retirement Planning, we are taking every precaution to ensure the comfort and safety of the families we work with. All visitors are seated 6 feet apart, rooms are sanitized and cleaned hourly, and masks are optional but encouraged. Retirement won't quit through this pandemic, and neither will we. Schedule your visit today.
We got this question from Dan in West Des Moines. Dan wants to know, I'm self-employed. Can I still open a health savings account? If you've got a question for our Ask the Advisor segment, there is a number on your screen right now. You can text your question there. So let's answer Dan's question. Lauren, what would you say?
Dan, the answer is yes. As long as you have a high deductible qualified health care plan that makes you eligible for the HSA, then by all means contribute to the HSA. It is one of the most powerful, from a tax perspective standpoint, types of accounts that you can have. Take advantage of it and then enjoy the tax-free superpowers that you will experience from the HSA in retirement.
And if you don't have one through your employer, there are other places you can go for an HSA.
Yeah, so as a self-employed individual, Dan, you would be responsible for providing that HSA vehicle. You can go to your bank or you can go to one of the large national custodians. For others of you out there who are not self-employed, you have an employer. If that employer doesn't offer you that HSA, but you still have that high deductible healthcare plan that does make you eligible for the HSA, again, you can go to a lot of the banks. Many banks offer it, or the national custodians.
And AnnaMarie, we just spent the last 26, 28 minutes talking about Medicare, but there is a lot more. You study this stuff every single day, and there's a really good opportunity for the people that are watching.
Absolutely. If you go onto our website at merkleplan.com, you'll see a schedule of upcoming Medicare webinars that we'll be doing, where I'll really be talking more in depth about what is A and B, what are my election periods like, the differences between Advantage, Supplement, what we've been talking here today, but we'll also be accepting questions as well.
Okay, so if you would like to sign up for one of those complimentary workshops, go to merkleplan.com to see when the Medicare one is happening. And remember, it is for a limited time. Let's wrap up, though, the mysteries and the misconceptions. First, Lauren, know the rules about Medicare and HSAs.
You need to know the rules. If you don't know the rules, you can get hurt by making decisions that you probably shouldn't have made. And you can also take advantage of the rules and the complexity that comes with Medicare. But you can't do that unless you know the rules.
Okay, AnnaMarie, another takeaway has to do with the supplement plans. Either do your due diligence or meet with someone who's done the research.
Yeah, it's so imperative to have a planner on your side. There's so many different options. And like we had mentioned, when you Google anything, you just get inundated with information, misconceptions, and myths. So really take the time and sit down with someone, let them know what your goals are, what you foresee in your own plan and what you expect, and they can go from there with you.
And Lauren, the last thing is Medicare is not the only piece. It's just one of the lanes kind of on the super highway to retirement.
Oftentimes when we talk about retirement planning, people think that we're talking about just the investment piece. The investment piece is one component or one guiding principle of your overall retirement plan, but you can easily see just through this conversation on Medicare alone how complex all of these different moving parts that should be involved within your retirement plan can really be. And people who don't engage in the comprehensive retirement planning are really leaving opportunities on the table. And a lot of times we hear feedback like, I wish I would have 5 years ago. I wish I would have known about that option or decision 5 years ago, because oftentimes people would have made a different decision. The importance of having a comprehensive plan that is specific to your situation, what you're trying to accomplish, is so you don't have to look back 5 years from now and say, I wish I would have.
Okay, and to learn about a lot more of those pieces of the puzzle, go to merkleplan.com to sign up for the workshop that AnnaMarie will be leading and to learn more about comprehensive retirement planning. We'll continue talking about it on this show. It's Retiring Today, and we thank you for watching.
Don't let 2020 derail your retirement. Join us for a complimentary workshop from 6 to 7:30 p.m. During this retirement workshop, you'll discover how to use market volatility to your advantage, tax-saving strategies to grow your retirement savings, and investing mishaps and how to avoid them in a down market. Spots are limited due to social distancing guidelines. Register now for this complimentary retirement workshop by visiting merkleplan.com.
You've heard stories from your family and friends. You may have even received a few calls from sales agents who want you to purchase this plan or that plan. Misinformation about Medicare is everywhere. How do you know what's important and what's just noise? Join us for a complimentary educational Medicare workshop on October 21st at the FFA Enrichment Center in Ankeny. Spots are limited due to social distancing guidelines. Register now at merkleplan.com.
Don't let the coronavirus get in your way of a successful retirement. At Merkle Retirement Planning, we are taking every precaution to ensure the comfort and safety of the families we work with. All visitors are seated 6 feet apart, rooms are sanitized and cleaned hourly, and masks are optional but encouraged. Retirement won't quit through this pandemic, and neither will we. Schedule your visit today.
From our family to yours, we hope you have a wonderful weekend.
We hope you enjoy the show.
We'll see you next week.